This is the second part of emergency triage assessment and treatment. In the first part, I have talked about triage. In this part, I will talk about assessment and the treatment of uh, airway problems or airway obstruction. The letters A and B in ABCD represent airway and breathing. It is evident that an open or patent airway is needed for breathing. An airway or breathing problem is life-threatening and must receive your attention before you move on to other systems. It is therefore convenient that the first two letters of the alphabet, or ABCD, represent the two most important areas to look for emergency or priority sign. So always, if there is no problem with the airway, go to breathing. Still, if breathing is fine, you should look for signs in areas represented by C. So first, we should have to give attention to airway, then breathing, then circulation, coma, and the convulsion. When we came to our today's session about assessment of the airway and its treatment, first, when you get a child at triage, you should have to check, is the child breathing? Is the airway obstructed? If the child is not breathing or if the child has severe respiratory distress, is there an obstruction to the flow of air is always the question that we should have to ask ourselves. Obstruction can occur at several levels. The tongue can fall back and obstruct the pharynx, or a foreign body can lodge in the upper airway. Croup can also cause upper airway obstruction. Coins and peanuts are notorious cause of aspiration and subsequent choking. A child with history of aspiration of foreign body who shows increasing respiratory distress is in immediate danger of choking. So attempts to remove the foreign body should be made instantly. Do not hesitate. Apply back slaps or Heimlich's maneuver. If a foreign body is causing obstruction, the treatment depends on the age of the child. For young infant or for less than 1 year, lay the infant on your arm or thigh in a head down position. Give 5 blows on the infant's back with heel of hand. If obstruction persists, turn infant over and give 5 chest thrusts with 2 fingers. One finger breathes below nipple level in midline. Still, if obstruction persists, check infant's mouth for any obstruction which can be removed. If necessary, repeat sequence with back slaps again. So back slap and the chest thrust. First with back slap, then chest thrust for infants for less than 1 year. For older children, for above 1 year, give 5 blows to the child's back with the heel of the hand, with child sitting, kneeling, or lying. If the obstruction persists, go behind the child and pass your arms around the child's body. Form a fist with one hand immediately below the child's sternum. Place the other hand over the fist and pull upward in the abdomen as you see on the image. Repeat this Heimlich's maneuver 5 times. If the obstruction persists, check the child's mouth for any obstruction which can be removed. If necessary, repeat this sequence with back slaps again and then chest thrust. After you have performed this procedure, you should check inside the mouth for any foreign body. Obvious foreign bodies should be removed. Secretion should be cleared from the throat or mouth of the children. The breathing should be checked again. If the airway obstruction is not from choking, you should have to position to improve the airway or to open the airway. To treat an airway or breathing problem, you should first open the airway, then begin giving the child oxygen. So we should have to open the airway based on different reasons or different background. For example, for non-trauma patients, we should have to do head tilt and the chin lift. For non-trauma patient, for those we do not suspect cervical injury. Chin lift and head tilt is a way of opening the airway in children who have not been subjected to trauma. This is based on patient's age. For infants, the nose is pointing upward or nose up, and for children, the chin is pointing up. So for infants, we should have to make slight upward movement of the chin compared to that of the children. In children, the chin is pointing upward, not the nose. In both cases, place your hands on the child's forehead and apply a little pressure. For those who have suspected neck trauma, we should have to do jaw thrust. If you suspect trauma which might have affected the neck or spine, do not move the head or neck as you treat the child and continue the assessment. To open and manage the airway when trauma is suspected, a jaw thrust is used because this is a way of opening the airway without moving the head. This is safe to use in case of trauma for children of all ages. The jaw thrust is achieved by placing 2 or 3 fingers under the angle of the jaw on both sides and lifting the jaw upward. So, as I have said, for non-trauma patients, head tilt and the chin lift is used, and for suspected neck trauma or cervical injury, jaw thrust is used. Then, after we open the airway by those procedures, if neck trauma is suspected, we should have to stabilize the neck. Stabilize the child's neck and keep the child lying on the back. Tape the child's forehead on the sides of the firm board to secure this position. Prevent the neck from moving by supporting the child's head. In emergency situation, you should have to use liter bags of eye fluid on each side if neck collar is not around. Place strap over the chin. If vomiting, turn on the side. Keep the head in line with the body. If the child is restless, ask an attendant to stabilize the neck without upsetting the child more. Log roll technique is a way of moving a patient with suspected cervical spine injury carefully. Always avoid rotation and extremes of flexion and extension. When we do this maneuver, one person, usually the most senior attendant, should assume responsibility for the neck. He should stand at the top end of the patient, hold the patient's head, place the fingers under the angle of the mandible with the palm over the ears and the parietal region, and maintain gentle traction to keep the neck straight and in line with the body. When the patient is not being moved, a sandbag placed on each side or cervical coral can splint the neck. This is all about the A or airway component of ABCDE. Next topic will be about the B component or breathing. Thanks for watching.